And Senator Verdon.
Thank you, Dr. Mack. I appreciate you taking the time, and just I'm going to share my thoughts and my opinions. What's discouraging to me sometimes about our discussions is that it seems like we're proceeding on a mutually exclusive basis. That if you believe in the efficacy of vaccines, which I do, and I believe that they are the primary means of stopping the spread, and I firmly hold to that opinion. I've expressed it. But the fact that I believe that doesn't preclude me from also recognizing, does it, that there are instances in which therapeutic options are going to be efficacious. I mean, I can hold both of those ideas in my mind at the same time. Is that
Absolutely.
Not correct?
Yep.
And it seems to me, and this was stated earlier by your colleague at MUSC, that we need to get away from the politics in this debate and down toward empowering doctors and letting doctors, based on that relationship with patients, to develop what that doctor believes is in that patient's best interests. And I think you can hold that position, in my opinion, you can hold that position and at the same time believe in the efficacy of vaccines and believe in the efficacy of therapeutics in certain circumstances, that these aren't mutually exclusive ideas, are they? Is that correct?
Correct, sir.
And am I also correct that as we look at COVID and as we learn more about COVID and as frontline doctors are dealing with COVID, that it's of necessity and has been a relatively fluid situation, right, in terms of what works, what doesn't work, having to adjust expectations, having to adjust therapies. I mean, we're very much we're not in an area where you've got settled medical science based on 10 years. We're kind of learning on the fly. Is that a fair statement?
Certainly, and I think that's the case for many of our diseases. And to your point, we used azithromycin, we used hydroxychloroquine early on, and have abandoned those as kind of the science has evolved.
And is it? And I take from that, and again, and I'm a lawyer, I'm not a doctor, and I don't want to be involved in medical decisions. But what I take away from this whole debate is, in that there is nothing settled from an institutional perspective. In other words, we don't have any absolute truths as we learn about COVID, that it would serve us to give as much latitude to doctors and physicians as possible. Is that not correct?
I think it's important to be open to the science as it changes.
And even in cases, and I said this earlier about the monoclonal, the Regeneron, and again, just observing it from a layperson's perspective, it seems to me that in regard to that one therapeutic, that there has been a shift in the medical community as to its efficacious, has there not, over the last few months? Not with children, I understand that, but in regard to adults, because
even with children,
okay,
I would say.
And I guess that's my point, is that it serves us well to be a little humble here and to have some humility here and to recognize we're not dealing with certainties. And I feel more comfortable in that situation giving latitude down to y'all, to physicians. And would you agree with that? That's the public policy response, if there is one from us, is to make sure that doctors feel empowered to do what they're trained to do, which is to consult with their patient, to understand that patient's condition, and then to have the latitude professionally to do what they believe is an evidence-based treatment. Is that a fair statement?
Absolutely.
Okay. Thank you, ma'am.
Thank you. Senator Verdon.
Mr. Chairman, I would ask to defer to the senator from Orangeburg and